Hi, and welcome to the 2.0 conference here in Las Vegas. This is Danny, your host, and I would like to introduce our guest today, Doctor. Like to introduce yourself to everyone?
Hi, my name is Edward Anselm, and I'm a clinical assistant professor of medicine and public health at the ICANN School of Medicine at Mount Sinai in New York.
Great intro. Great intro. So, you got the Conference and Visionaries Award. How did you feel about receiving that recognition for your industry today?
Well, I think this is a great opportunity to get the message out. The reason for getting these awards today is because the conference organizers recognize the global significance of my content. And this is a real opportunity to meet people, share that content, and educate a larger audience.
Okay. Yeah. Great answer. Yeah. So, advice you would give to people trying to follow into your footsteps for what you're doing in your industry? What are your recommendations?
I think the most important thing is to have a vision of what you want to do.
Focus.
Look for role models and follow their pathway. There's so many ways to achieve your own ideals, but you need to have a plan and you need to be organized. I've chosen a pathway through organized medicine and publication and scholarship. Other people will choose other pathways, some of which were discussed at this conference.
Great. So, networking wise, what's your feedback so far at the conference? I know it's day one, but tell me what your thoughts are.
Well, I've met some extraordinary people, and I would say that it's already been personally transformative for me. I've learned from the conversations, from the presentations, and we're only 1/3 of the way through. So I think it's a fantastic conference.
Perfect. So tell me, how can you help current smokers and vapors better manage manage their dependence and their risk of future diseases?
Part of the issue is that people don't know their choices. If you use
That's true.
if you use nicotine,
Yeah.
and there are over 50 million people in the United States that use nicotine in some form or another, what people don't realize is that they don't have to use the most toxic form. Cigarettes will kill you 10 years sooner, right? So why not go to and age you? Yes, skin, it's horrible, but so why not become educated about what your choices are? And my whole presentation is about choices. And people have choices in how they can quit. People have choices in how they can reduce their harm. And my goal in this presentation is to help people understand those choices.
Okay, that's good. And how can you help medical practices measure and maximize their performance in tobacco concession and harm reduction? It's a long-winded question.
Yeah, it's one really long
it's
question,
a long-winded question.
but building on the first set of understandings,
Okay.
clinicians need to help their patients make
First.
better choices,
Yeah.
right? But in order to do that, as with any business, you need to measure and manage what you do. And my work shows that when you measure and manage what you do, not only do you get better, and do you become more effective in helping your patients, it actually flows to the bottom line. That is, a key hook for doctors, this being capitalism, is that when you do help your patients, you maximize your own economic performance.
Yeah.
So
It's true. It's true. So tell everybody, how can they get in touch with you? How can they reach you? And what's it called? And any advice?
Well, get informed is my basic advice. And if you Google my name, Edward Anselm, MD, you will come to my website, which lists all the information. All of my tools are in the public domain. I'm not selling anything. I'm just giving it away because I want to empower patients and doctors to make better choices for themselves and their medical practices.
Do you have a LinkedIn? Can people follow you on LinkedIn?
I'm also on LinkedIn. Yes.
Okay, Edward Anselm. Okay, perfect. Thank you so much.
Thank you. It's a pleasure.
Thank you. Bye.